도지근하냐 매정대에 전점대배는 동네에서 동순내에서 산제 맨게라 빈도라여가 차세 치시남반야가던 로와 치시네 요바 치시단네 요네 로에 동네에서 와쇼 Hello, Namaste, Rashidile. I'm Dr. Tara. Today I'm showing especially my Indian friends. I'm showing here back pain, knee pain, and constipation problem and sleeping problem. More for issue. One for many people these days in 21st century. Now they get too much in back pain. Okay, whenever they get morning wake up, they can't suddenly. It takes time. Also, they get back pain, and also these days many people they get in the knee pain. Okay, and another one, constipation issues huge over, and disturbing sleepless problem. Many people they get problems. They are using many sleeping pills. That is very bad for your memory, for your brain, and your digestion systems. That is very bad. So today I am showing you only one exercise, only 2 minutes. No need buy any things for this exercise. Also, don't expend for time on this exercise. Okay, this exercise is only you can do just before sleeping at night. Only 2 minutes on the bed, not on the floor, not on the yoga mat. You can do on the plywood. It's okay, exception. Okay, if you have back pain, knee pain, sleeping problem, constipation problem, these 4 issues, if you have these 4 issues, you have to do this exercise only night just before sleeping, not morning, not daytime, only night. When you go to bed, that time you have to do only 2 minutes. One exercise I show you. Okay, please, you have to do this 1 week. You continue, you do it, you try it. I have to say 99% people get relief for this after taking this exercise. Okay, also it helps high blood pressure, sugar problem, and cholesterol problem, digestion problem, gastric problem, heart circulation problem. This is indirectly helps. Directly it helps knee pain, back pain, low back pain, and constipation problem, and sleeping problem. Just we have to do this exercise. I show you. Okay, exercise I show you. You have to do on the bed. Also you can do in plywood, on the plywood. No yoga mat, no on the floor. Okay, just like this. Just first 1 minute and 30 seconds. Just you full relax your full body. Okay, breathing regular. After 30 seconds or 10 seconds as you wish. When you go to bed, going to sleeping, that time on the spot you have to do this exercise. Just lie down like this. Okay, then slowly your knee bend. Just bend like this and just up like this. If you have pain, then don't force, just general, just do this. If you have no pain in lower back and knee, then you can do little bit press. Breathing regular, full relax. Your full body relax. Just 2 minutes, just only 2 minutes, okay? Old age, it can't for the totally bend. If you can do like this, old age, what you can, you have to do. But don't force, okay? 2 minutes, only 2 minutes, just hold it. Breathing regular, you have need for the pillow. Just 2 minutes, just hold it. It helps your lower back pain, your knee pain, your constipation problem, and sleeping problem. It is very helpful. Just try it. This is magic exercise. Just 2 minutes. This exercise helps especially for in spinal circulation, all spinal channel circulation, they are going to properly. Then its Vayu will be balanced. You know Vayu, air. If air is balanced, then every digestion, every other channel will be okay. Okay. Just 2 minutes. Also, this exercise helps your spinal setting, spinal bone setting, and tailbone setting, pelvic bone, and knee, and thigh, and leg bone. Everything should come for their own place. Setting will becomes normal. Then your all pain is going to disappear. These days, many doctors advise for this is arthritis, this is lumbar spondylitis, this is sciatica. Every kind of the disease helps for this exercise. Just 2 minutes, simply hold it. No need any things buy from market on your bed. No expend money, no expend your time waste. Okay, no need go to hospital. Just do this exercise at night before sleeping. Only night before sleeping. Okay, just before sleeping. After 2 minutes, just release like this and just push down. Just 30 seconds, just relax. Then you can go to sleep. Just to try 1 week. I promise, I challenge you. Your many kind of the problem it will be solved. Thank you. Please share and subscribe. Please help for patient. Okay? Thank you.